Assalamu alaikum viewers, this is Dr. Khawaja Saajid Aslam with the program Bone and Health. I'm orthopedic surgeon. I do hip and knee replacements, arthroscopies, and deal with the fractures as well. Today I'm talking about sports injuries, and specifically sports injuries in adults, not in children. Sports injuries in adults, I think most of us knows that what kind of sports injuries could be in adults, especially playing football or rugby or these kind of stressful, like squash, stressful exercises which involve mainly the knee joint or hip joint. Most common injuries during these kind of sports activity is either meniscal injuries, the cartilage between two bones, I'm talking about the knee specifically, or it's a ligament injury like anterior cruciate ligament or posterior cruciate ligament. Very rarely medial or lateral collateral ligaments can be involved as well. But those kind of very severe injuries. The most important thing is during any sports activity, if your knee gets hurt, if you are not able to bear weight on that leg, or you cannot continue your game just after the injury, it means there is something serious. If immediately your knee becomes swollen, big one, it means there is something serious going on. But if you can continue your game afterwards, or you can walk, you can bear weight on that leg, it means there is problem but not so serious. So that's a general thing. What people have to do immediately when there is specifically knee injury during sports is to give ice compression. If ice packs are not available, you can take any like ice and keep it in a fabric or in a towel and put it on top of that. That will reduce the swelling, that will decrease the pain, give more comfort to the patient. Then of course you can immediately consult to the orthopedic surgeon. Don't bear weight. Don't put weight on that leg. If you cannot bear it, don't do it unless it's diagnosed what is the problem. Because some problems can get worse once you bear weight. Or if you just really become brave enough to continue your game, although you cannot, then the problems can get worse as well. So don't do that. If you can't, don't do it. Once orthopedic surgeon will see you, he will examine you, he will diagnose, he will investigate, either with x-rays or MRI scan or CT scan, and then he will give you treatment accordingly. All I would say, not all ACL injuries, that's also a myth in the people that I got my MRI and I got the report that it is ACL tear. It's my clinical experience that there are few patients who got reported as ACL tear, but they didn't have any symptoms regarding that. And when I re-reported that MRI scan, the thing was entirely different. Or when I went for the arthroscopy and put the camera inside the knee joint and I had a look by myself, I found the ACL was completely intact. So all I mean to say, just don't go on reporting. Just don't go that ACL reported tear, so you need ACL reconstruction. It's not always like that. So doctor will examine you, then he will correlate with the investigation and give you final opinion and diagnosis. So don't worry about these things that they reported ACL tear, so you will get ACL reconstruction. No, not even all ACL tears needs reconstruction. As far as meniscal injuries are concerned, they are treatable as well. Very simple arthroscopy, we insert the camera inside the knee joint, which I have done, I think, previous few programs in detail that how we do arthroscopy, what are the benefits and disadvantages of that. Briefly, I would say it's a wonderful procedure. If you have any meniscal problem, go ahead for arthroscopy. It's not a big operation. It's very tiny, 1 centimeter cut inside your knee joint, and we insert the camera over there and had a look by ourselves. It's a daycare surgery. You come on the same day, you go home on the same day by walking after a few hours, and your problem is more than 80% solved. So don't ignore your knee. That's very important, specifically when you get injured by during the sports activity. It could be from fracture, from minor muscular spasm, sprain to any meniscal or ligament injury. So take care of yourself and your family and your health as well. On display is my contact number in case you want to contact me or you want to get the appointment. You're most welcome. Thank you.